I'm going to try and make this interesting, I hope, and interactive with special monitoring from Joss on that, because I know I have a time limit. As we go along, I'm going to be talking about impact evaluation, but also my experience with setting up monitoring and evaluation systems. Half a second of history. When I joined Columbia University about 4 years ago, I was employed by Professor Jeffrey Sachs, and he pulled me away from the UN. I was working with UNDP at the evaluation office, and he said, oh, well, we need an M&E person. And I turned up at the offices, and I went to him and I said, so Jeff, what's my budget? And he said, what budget? So I said, well, we can't do M&E without, without some resources. From then, we were a one-person team. We are now a team of 14 full-time professionals with field teams all across Africa. So it's been a long road, but a fun ride. And now I'm also on my way to sort of getting away from Columbia University and the Earth Institute, and then I'll be joining UNEP later this year, but that's a different story. So what I'm going to talk about today are some of the lessons that you can take away as a humanitarian agency, and some of the things that we learned, at least. And hopefully it'll help you. So the Holy Grail statement that all of you would want to make is Agency X, IFRC, caused a 30% reduction in mortality over the past 3 years. Parse the statement a little bit, and you'll realize it's a really complicated statement for those that don't know this already. Caused. That's a really critical word. A 30% reduction. There's a magnitude, there's a baseline, and there's data that's been collected at year 3, definitely. In mortality, measuring mortality, hugely different question as well over the past 3 years. And that's the time span over which you'd want to be measuring this impact. Given that, everyone knows this. Everyone wants to be able to make these kind of statements. Or, as a humanitarian agency, you probably want to make, you want to have a graph like that, where I have percentage of households on the left-hand side. I'm so sorry I can't tilt this PowerPoint so all of you can see it. But if some of you want to move, I'm absolutely happy with that. But on the y-axis, I have percentage households, and on the x-axis, I have some indicators of impact. Human rights abuses, economic and social links, and then one indicator which says no aid reached us. And this is gauged over 3 years. So ostensibly, you'd want to make a statement like that as well. And yet, you can't read the cartoon, but basically what it says, there's a big board that says, dollars see, gringos no. And then the guy is telling the other guy, I sometimes wonder how they feel about our foreign aid. There's a huge poster that tells him exactly how people feel, but he definitely needs much more by way of information. And this is fairly common as well. So these are boxes that are being, heli dropped. And all of them have written on them all new community project with different dates. So there are different, the box is the same, but the dates are changing. And obviously, donors feel like they're doing something, but they don't know what they're doing. And there's no feedback to tell them what is going wrong, if at all. Is this relevant? Are the boxes that they're dropping relevant? Are they making an effect? So I picked this up from the Huffington Post. Again, you would have all seen it, I hope. Major aid organizations duped donors and failed Haiti group charges. And they talk about how after billions of dollars in cash was raised, earthquake survivors are dying of cholera because conditions are so poor. what is it really pointing towards? It's pointing towards, well, is there an impact that you're making? Is there a change in living conditions, water, sanitation, housing, and therefore cholera? And then I picked up, other statements as well. But basically, the point I want to make here is, you want to be looking at impact. I'm hoping that all of that part, I'm singing to the choir, I hope, in that sense. You want to be also monitoring. You definitely want to be monitoring, but you also want to be measuring impact. You're looking at activities, but you also want to be looking at beneficiaries. Who are your beneficiaries? How are they changing? What are their conditions? Both are important, but why? And let's talk about that. So this brings us to the big question of evaluation. Very quick straw poll. Everyone knows what effective is? A program that's effective? Just hands up. I'm not going to ask you definitions. Okay. Efficient, cost-effective, relevant, sustainable, replicable. These are the questions that, these are the DAC criteria. These are the questions that most people want to know of an evaluation. Real-time evaluations are put together hoping to answer some of these questions. But guess what? Real-time evaluations will basically talk about monitoring. What has been delivered in terms of activities? What can you say about the outcomes and the impacts? Everyone knows the distinction between outcomes and activities? No? Yes? Okay, well, we'll go over those. So I'm quickly going to look at what the definitions mean, because this is really key to understanding how and why we should be measuring impact. Effective. Are the interventions creating the impact? So there's a causality and an attribution statement here. Yeah? Relevant. Are they doing it for the right people? So are they relevant for the right people? And are these the right interventions? So once you get to effectiveness, you build your causal chain or your theory of change, and you can get to the question of relevance. Efficient. Is implementation being done right in the best possible way? Cost-effective, sustainable, and replicable. So all of you, I'm hoping, have had some experience in the field, etc., with activities, with a lot of reports, etc. But you're obviously all talking about tasks and activities. And the idea is to really link them up through theories of change to impact. Importance. Did we do all that we promised? Did we have the positive impact that we are touting? What would have happened had we not done had we not gone in? So, for example, in Haiti or in Afghanistan or with the tsunami response, what would have happened had the Red Cross not gone in, for example? I want to quickly, talk about a study, a meta-analysis actually that I did, that used control groups. Now, very quick statement on attribution, causality, and control groups. As you all know, one of the big problems in evaluation is really making the statement, the Red Cross went in and caused a change of 30%. What would have happened had the Red Cross not gone in? How can you measure that change? And, because people who are not receiving aid are different and are not the same people as the ones that are receiving aid, they're not equivalent. So one of the biggest problems in evaluation is really to figure out what would have happened had that intervention not occurred. So what do? In economics or in applied economic theory, you create what are called comparison groups or control groups, which are the same thing as what you do in medical trials. You have control groups where you keep everything else constant, but you change one thing, and that's the intervention. And so you compare them before time and then after the intervention, and you do a comparison. And that's exactly what is done in a medical trial. So using control groups, or in socioeconomic and development projects, what we call comparison groups, because really you can't control anything. In a development project, you can't control anything other than the fact that you yourself are not there providing aid to the control group. So that's why we call them comparison groups and not control groups in the real world. So using comparison groups, there are different studies that were done looking at what are the best strategies to induce an extra year of education. And contrary to what a lot of people believed, the evidence that we found was quite interesting. Progresa, which is a program that has been rolled out in Mexico, which contains conditional cash transfers to mothers for going and getting antenatal care, for doing antenatal care visits, for sending their children to school, and conditional on that, they get transfers every month. And that's a program that actually is sort of the holy grail of development aid in terms of establishing what evaluation can really achieve, because that program got scaled up in 1995 from $2 million in 2002 it became $2 billion. So, and that's all because of the evidence that came out. So in 7 years, it got scaled up by an order of magnitude. And all of it is attributed to the evidence that came out of the Progresa data collection process and the evaluation methodology that was undertaken. So Progresa actually turns out to be really expensive. You have to spend about $6,000 to induce an extra year of education, for primary school students. Deworming tablets and school meals turn out to be the most cost-effective way of inducing an extra year of education. Now, this is not something that people would have otherwise sort of known. There are lots and lots of programs out there that go and do conditional cash transfers, that go and provide school uniforms, that provide scholarships, that say that attendance is all a function of an extra teacher being there. So what this analysis presents is really the evidence that some interventions just turn out to be much more cost-effective by an order of magnitude than others. And so going forward, if you're presented with this really compelling evidence, and this is across the world, so it was done in India, Kenya, Mexico, different sorts of studies were done, in all of those countries. So a few needs of when you're doing an impact assessment. Have to identify who your target group is. What are their needs? Specify your intervention. And I understand that, at IFRC, you're not just thinking about one single intervention. You're not just thinking about, let's just provide shelters, or let's just provide vaccinations. You're thinking about a package of interventions. You're thinking about, and the package of interventions is provided, the dose of these interventions changes, and the intensity changes over time. And that definitely makes it complicated. But as I'm going to tell you, we were faced with the same problem with the Millennium Villages project, and we dealt with it in a fairly, I think, creative way. So how should we judge impact? The first scene is, before the earthquake. This is the earthquake, and that's after the earthquake. And if you were just to look at, of course, before and after, you would think that there's been no change. But when you look at the picture immediately after the earthquake and then measure that change, you get to see the impact that's been made. And so the question of timing is critical as well. When should you collect data? Who are the people who are targeted? And what are the comparisons that you're making? Okay. So before we go on to looking at some of the experience and the evidence that's been coming out of impact evaluation and monitoring and evaluation systems, just a couple of lines on when should you do an impact study. Now, let me be very clear. Impact evaluation or evaluation of any kind is not cheap. You're not going to, sort of say, oh, we have a small little budget, let's just do something small. When you're doing a process evaluation or a real-time evaluation, yes, you need a budget, but it doesn't have to be large. When you're doing an impact evaluation, definitely, you have to devote resources, time, money, people. And it has to be a concerted effort. So, but all forms of evaluation, whether these are process evaluations, whether these are qualitative, quantitative evaluations mixed, and my personal favorite, a mix of those two, qualitative and quantitative, you have to have resources. So when should you do an impact evaluation? Common program with not too much evidence out there as to whether it's working or not. Uncertainty about which alternative strategy to use. It's a strategy that, or the third condition under which you should be doing an impact evaluation is it's a strategy that is being used by a lot of actors and a lot of programs, but no one's really asked the question of, well, are we being effective or not? And there is the goal or the vision of scaling them up and also using the same interventions in other places. And then if you have important design questions, a lot of people will actually say, oh, well, what we're really struggling with are operational questions. What operational framework works and what operational framework does not work. Guess what? You can use a lot of the lessons that you would learn from doing an impact evaluation in assessing the effectiveness of different operational mechanisms as well. And so then timing, like I said, is key as well. You have to plan these before the intervention is undertaken, but in the case of humanitarian crisis, you obviously have a little bit of a different paradigm within which you're working. But I'll talk a little bit about what we're planning for Haiti as well. And then the program is representative. Try and do an impact evaluation for a program which is representative, which is not a one-off program that's never going to be continued or replicated anywhere else. So those are sort of the initial sort of conditions that you should, or a checklist that you should definitely look into before starting off with this. Okay, so I'm going to give you an example of the M&E system that we set up at the Earth Institute. But before I go on, questions? Clarifications? Is this boring? Okay. So this is, very quickly, the Millennium Villages project is distributed over 12 countries, 14 sites, covers about 600,000 people. They're all across Africa, and the main objective of the project is really to say that a package of interventions can work with a defined budget of $110 per person per year, and you can achieve the MDGs with that budget. So the goal is to prove is to show that can be done. The operational mechanisms What are the operational mechanisms that are required? What are the governmental mechanisms that are required? And what are the capacities that you need to build to get to that? So this is, so these sites, so just a line about them, these sites were not picked by, so the Millennium Villages project is implemented by UNDP. The funding for that is, there are many, many large donors, and the largest one of them is Jyotsna. But there are lots of private donors who then provide donations to what is a completely separate funding arm called Millennium Promise. And the Earth Institute now provides technical advice, but for the first couple of years was also helping to implement. The variety of sites that have been picked really show sort of the range of agroecological zones, but there are several things that are common. First, almost all of these sites had a poverty rate of 70% or more. All of the sites had malnutrition rates for under 1 of more than 70%. And all of these sites are extremely remote and inaccessible. And they really, I know you've probably seen the worst of them, but, and I grew up in India, but my heart still goes out every time I visit. Okay. What else do I want to say? So yeah, and the second important feature about the Villages project is really that they want to achieve the MDGs, but it's with a set budget, which is $110, of which the project provides only $50. The rest is raised either through community or from government or from external partners. Yeah, it's a complex. The only reason I put up this slide is to hopefully sort of mirror some of the complexities of and the institutional challenges that you all also face in the field, which is, you have many chapters and countries, etc., that you're working with. So this is UNDP, Columbia University, Millennium Promise, just working in the United States. And then in the field, there are MDG centers that are completely separate and autonomous agencies by themselves. And then each one of the sites, which is, has their own office and their own mechanism and their own culture as well. So there are 5 components of the M&E system that we set up. First, pathways. Second, the impact component. Third, monitoring, process assessment, cost effectiveness. Almost all of you will know what a logical framework looks like. The only reason I'm going to put up this slide is to actually highlight one of the problems that I had when I joined the Earth Institute, which is none of the scientists there, all of them extremely respected and wonderful in their fields, ever wanted to deal with logical frameworks. They'd seen them and they just felt this is something that the UN does, we don't do them, sorry. And yet, the force of a framework in conveying and communicating across all offices, all teams, in communicating the activities, the timelines, the indicators, the outputs, and the aimed for goals and impacts is just critical. So one of the things that I did was actually re-christen them impact pathways, and that worked pretty well. And so we started to call them impact pathways, and they work in exactly the same, well, with some tweaks. They work in very much the same way as logical frameworks do. The one thing that I want you to take away from this slide is that, when you're talking about activities, you're really talking about process. But when you're talking about, so this is once you've identified what your problem is, and you're looking at once you lay out a framework such as this, where your problem is poor returns to agriculture in Kenya, you identify the proximate reasons for that: low investment in agriculture, poor access to markets, or poverty of farmers. And then you say you're going to pick one aspect of that to try and address through interventions. And that's through trying to deal with the income problem. And you identify fertility of agriculture as the big problem. So the MV, Millennium Villages, distributes fertilizer. The fertilizer is delivered, it's used, and farmers find fertilizer useful. All of this constitutes a process evaluation. Then fertility improves, so there's more crop on the plot. That's an impact. Higher income, that's an impact. But you have to then devise indicators for this to try and measure what's happening. Targets. Okay. Sorry. I was going to give you an example of an impact pathway, but I would think all of you have seen a logical framework. Yes? Okay, good. Okay, so some of the indicators that you would want to use: how many bags of fertilizer, when was it delivered, how was it done, how many households use it. That would be an outcome, but those are sort of the indicators you'd want to collect data on. For impact, the yield change and income change. Notice, of course, the impact, just as a mnemonic, is something that you have partial control on, not complete, because there are other exogenous factors that are going to change it as well: government, earthquakes, other donors, etc. Activities are things that you have complete control on in terms of operations. So the second component is surveys. And the cartoon says, how do you feel about being trapped in the rubble? So they have a video camera. And this sort of, harks to the question of survey fatigue. I'm sure, all of you think about it and have heard about it, etc. And that was definitely one of the big questions that I had to deal with when I joined Columbia, because there was an initial baseline that was being set up. There were 14 different survey instruments. Each survey instrument went to each one of the households and took at least an hour. So which meant that every household had to give away at least 14 hours of their lives. That's only in 1 year. And then if they were going to be doing it in subsequent years, it was going to be a complete disaster. We decided to rationalize that. Surveys within the project are done for 300 randomly selected, well-stratified households per site. There are 6 million data points that are generated. And I want to point this out because, doing surveys is not easy. You need exceptional field operations. You need very, very good supervisors. You need to have your finger on the pulse. You need to have very, very good computing systems, and you need to have really good technology. And you need to have warm bodies and people who are really passionate about this as well. So we expected to generate 6 million data points. Except by the time I joined, it had been about a year and a half, and we were still cleaning data. Obviously, that had to change. Also, so I'm going to come back to that question of what we were doing with data and how that changed. So these surveys are conducted at baseline, year 3, year 6, and hopefully will continue. There are also anthropometric measures, so height and weight that are measured. Biological specimens for urine and blood. And plot level data, so crop yield data for 30 to 50 randomly selected plots and stable crops. and then comparison villages. So, when I first joined the Earth Institute, there were no comparison sites, and given that a large part of what I wanted to establish was definitely causality and attributed to the villages, whether it was going well or not well. The idea had to be to try and compare it with other candidates. So we ended up then identifying post-fact, and this is why timing is important, but it's not something that you can't deal with. We ended up establishing comparison villages after the interventions had started, using fairly creative ways. One, there was a list before these villages were selected, and we basically ended up looking at that list and then randomly selecting one and then doing the same surveys there as well. Just some evidence that actually initially surprised us. A lot of the data in crop yields compared to pre-intervention. So this is increases in crop yield. So this is all compared to comparison plot sites and relative to pre-intervention yields. All of the red ones are actually not doing as well as the scientists within the village had been touting. The black ones are doing pretty well. So, which means that as soon as we got this evidence, we could take it back to the teams that were, that were working with agricultural interventions and ask them. And we managed to turn around this data very, very quickly. We asked them as to what was going wrong with the agricultural interventions, and you'll see it was a question of dosage. And so this is why dosage, in the sense of not enough investment was being made in the agricultural package that was out there. But it's not something that was getting picked up either as part of chatter or as part of reports coming from the field, because everyone was wishful thinking. Of course we are doing well. Of course our yields are increasing. Of course this farmer did so well, and these 5 farmers did so exceptionally well. Of course it's because of us. But once the data came out, it gave us a really firm grasp of what was happening on the field as well. And then just a couple of slides on proportion, of some other indicators that we follow. A proportion of children under 5 sleeping under a bed net. And what I really just want you to take away from this slide is at the time that this graph was made, we didn't have comparison village data coming, but basically the red points are the national data. So we're comparing it against national data. The blue bars are pre-intervention and the green bars are post-intervention. And then the purple bars are basically saying what's happening in the comparison villages. And the same thing for stunting. In almost all of these villages, we can see that there is a reduction in stunting. And so it's in Ethiopia, Ghana, Kenya, Malawi, Uganda. And on average, stunting went down from 51% to 34%. I'm going to rush through these because I want to talk a little bit about the technology needs as well. When you're talking about impact, one of the big things at the early stages of our work was that because we had these really bright leaders and champions, a lot of them were making lots of statements in the press. Oh, we are doing exceptionally well because our living standards are changing, poverty levels are reducing, but we didn't have any data to back it up, and we didn't think actually that we were doing that well. So impact evaluation turned out to be the only way that we could really deal with, even going to much senior champions of the project, would basically saying, okay, maybe you want to, be a little more cautious about the way you're stating impacts. And on the other hand, for things that were working really well, we managed to provide a lot of evidence. So what would you want to do? You would want to build a short and focused survey if you want to compute impact. Collect data on all eligible population, irrespective of whether they are benefiting or not. Because guess what? This gives you the comparison as well. When you have non-beneficiaries of your intervention, then you're building a comparison group implicitly. So you would want to try and capture data on as many people that are representative at say, in the case of Haiti, at a national level. And then try and, the communication of these messages is, of course, really important. So the two other things that I want to point out are the immense importance of monitoring and of looking at the intensity, the disbursement rates, etc. A lot of academics, especially, will obviously say disbursement rates, etc., are not good enough. They're not good enough. But if you don't have them, everyone will ask you about them. And they have a really important role to play in impact evaluation. And this is something that I learned, as we were going along. We couldn't figure, because the package of interventions that the MV was providing in the field was fairly large and complex. It was in agriculture, health, education, water and sanitation, gender, environment, infrastructure. So it's a package of interventions that's going out into the field. Very hard to then say, what is your single most intervention, right? And so given that, you want to have really good data on which are the interventions that you're spending on, which are not, and disaggregate it to a very, very high level. It worked out it held me in really good stead, because we managed to connect what is the dosage, which is, how much are we spending on each particular intervention, the intensity, the timing of that intervention, and then link it to the impacts that we were seeing. In a really interesting example, in one of our sites, we found that our child nutrition indicators were doing extremely well. And our health teams were really ecstatic. They said, oh, well, we're obviously doing fabulously, and there was a lot of cheer. But when we looked at a lot of the financial data that was coming out, we realized that actually the health team wasn't spending that much in that site. And actually, they were spending negligibly. The impact was really coming from the agricultural interventions, because there were lots of school meals that were also being distributed, and there were a lot of educational programs that were also going out to the mothers. The impact was really coming from the education sectors as well as the agricultural sector, rather than the health sector. And so, in that sense, sort of disentangling these interventions and knowing exactly where, how much, when disbursements are occurring, etc., is a really critical component as well of an evaluation, of an impact assessment as well, especially when you're dealing with complex programs. So this slide, this slide and the next slide, basically all it points out is that contrary to what we had initially assumed, that a lot of the budget of the MV would be spent on business development and farmer training, seed and fertilizer distribution. Just the distribution, just the logistics of it, constituted the largest part of our program. And that definitely was surprising. And the same thing for health and education as well. Clinic operating costs turned out to be the largest component of our health sector budgets, as well as for schools. So I want to come to the last. We're doing okay for time. Last component of this session, of my talk at least, which is on process evaluation and using technology. And I'm proud of all of it, but I'm especially proud of this section of it, because we ended up using technology in really cool ways. For a part of our M&E system, which a lot of people actually sort of say is too touchy-feely, it's process and it's monitoring, but it really gave us insights that have fed into our impact evaluation and made the system extremely strong. So there are two things that I'm going to highlight. The first one is the Millennium Villages information system. It was very, very easy, flexible, cheap. It cost us $60,000, the entire system. Cheap system, information system that we basically put on the web that links up all of our sites, that links up all of our offices, everyone in the field, that enables us to put in our impact data as well as our process data, monitoring data. So the Millennium Villages has surveys, as you remember. We collect about 6 million data points at each one of these surveys. We also have what are called monitoring indicators. These are collected every 3 months. These are 92 in number. Every office reports on them. For some offices, of course, they're not relevant, but mostly they're relevant. The process of reaching these 92 indicators is extremely political as well, but really fun. And now they're written in stone. But this system brings together a flexible and easy online system, and it works offline as well, for everyone to see the data, which is impact related as well as process related, activity related. It has basic cluster information, which is demography, infrastructure, and cluster maps, quarterly performance data, numeric and qualitative, because all indicators don't lend themselves to either one, to just being numeric or just being qualitative. It also brings together the MDG data, the survey data that we're collecting from our, from surveying 300 households in every site. So that's 3,600 households that we are serving at each point of time. It customizes graphs, reports, and data tables, and allows you to data download. What is good about this system is that sites can put on their data, can put in their data from wherever they're located. They can log in, and the system will actually mark for them data that they've incorrectly put in. So there are range and logic checks that are built into the system, which will then, if they put in, say, a -1 where there should be a positive value, it'll pick it up. Or if you're suddenly reporting that you're affecting that 50,000 women are going to clinics now, it'll shoot up a warning sign and say this is not feasible. Or if you suddenly say that you've been able to extend 10 kilometers of roads in the past 3 months, it's going to say, well, this is hogwash. So these are just a list of the indicators that we basically have for health that we have. There are 31 indicators just for health. So number of primary health clinics fully equipped in the past quarter, providing free primary health care in the past quarter, number of health staff, etc. Now, a couple of things that I do want to point out, if you don't know this already, indicators have to be time-bound. All of them will say in the past quarter. There is an entire manual behind this which will give you the definition. There is a template which goes to provide information on how each indicator has to be measured. We've conducted several training programs with field teams for them to know how the data has to be collected from, say, each one of the schools. Even attendance rates, or gross attendance rates, or net attendance rates, is a fairly complicated formula if you're thinking about 200 schools per site, and you're trying to look at attendance of children. But that's an MDG. So if you're trying to measure that, you have to train people to do it. I think that's what I want you to take away. Okay. This is just showing the interface where sites can go themselves and can put in data themselves. It also shows graphs of data that you've previously collected. They can download the entire, if they don't have connectivity, they can download it and just have it. All they need is connectivity for 20 minutes at one point in time, and they can have the entire system on their laptops or on their PCs, and they can go through it at whatever point in time they want. It also allows for qualitative data or comments to be put in. So when we are sitting in New York or in Geneva, suddenly if I see a spike or if I see dead data for the next year, I know how to interpret it, and I know not to interpret it missing data as a zero, but to know that it's missing because there was a flood, say, in the site. And then what it churns out for us are these sector reports, which goes to really cater to each one of the sectors and provides them with ratios so that they can use it in a standardized format and can report using the same numbers. It's not as if one field team person is using one number, and we've had a lot of that, and then another field team person or people sitting in New York or Millennium Promise are reporting completely different numbers because they are using hearsay or whatever means of collecting data. So and these are just examples of bar charts. So at the bottom of the screen, what I want you to notice are that there are 3 different tabs, indicators, MDGs, and preset templates. And basically, this allows you to really show all of that data or combine all of that data and show, for example, that if you've had a net increase in enrollment, you can at the same time talk about school meals programs, number of schools constructed, number of teachers trained, and access of schools to roads. So you can talk about the monitoring indicators that have changed alongside your impact indicator that you're trying to measure as well. Okay, and then mobile phones, the brave new world. One of the problems that we faced most recently has been in Nigeria and in Timor-Leste, where we were asked really by the Office of the Special Assistant to the President in Nigeria to set up an M&E system for 20 million people for interventions that they're undertaking, in health and in education. And they want to show that they're making an impact. They want to show that they're reaching the MDGs. So there's no way we can set up teams that cater to 20 million people. And we use the mobile phone and Android phones. So that, actually, in one of the hyperlinks, I forgot, I didn't click it, but I did want to show you a template that we've put together. Very nice, sweet little template, which basically is used on a Google Android phone, which basically, so the template comes up on your handheld, and I'm sorry I don't have one with me, but it basically, it comes up on your Android phone, and you can put in the alternatives or put in the responses and makes you go to the next page. And we managed to create this template, and data collection, turnaround times, and data cleaning has reduced from, I think, 2.5 years to a month. So, and the only reason it's actually a month is because we insist that there is a warm body that looks at the data before it gets released, but otherwise it's instant. So that it really has revolutionized the way we're thinking about data, we are thinking about evaluation, the way we are thinking about monitoring, and definitely the way we are thinking about scale. Because first, when we were asked to take it to 20 million people, we all just sort of threw up our hands. So this is an example of rapid SMS being used for MUACs, so mid-upper arm circumference measurements. And this is a project in Kenya, which we are also now scaling to the rest of our sites for calculating indicators of weight and height. It's a really the system basically allows us in a very cool, quick way to register patients. So this is just an SMS message which goes out, which says new. So this is a new patient. Diallo is the last name of the patient. Fatimata is the first name of the patient. F for female. Birth date. The guardian. So Fatimata is the little baby or the child, and then the contact number, and that's the SMS that you send out. So we have these one-page sort of cheat sheets that are given to each one of the community health workers that we work with, and they know how to write out the SMS, and it requires half a page for them to really understand. And that's what goes out, and you immediately get a response on your mobile phone, which says patient registered, Diallo Fatimata, for 13 months, mother is Ami, blah, blah. And then a malnutrition report. So the first part of the SMS just says MUAC, patient ID, which is plus 28, and then the MUAC measurement in millimeters and whether the patient has edema or not, and other symptoms, vomiting, diarrhea, BD. Yeah, so, and at the bottom of the screen is what I want you to look at. You send out a rapid diagnostic report, and you get a response which says, child is less than 3, please provide 1 tab of coartem twice a day for 3 days. This is something, which is helping us get to people in the field really, really quickly as well. How's the data saved? At the back end, it's just on the web. It's online, you can access it from anywhere, and you can see the reports that are done, incidents of moderate to severe stunting, edema, as well as diarrhea. And these are generated instantly, and they are updated instantly. So child registrations, after we started with rapid SMS, the green is our control group. The blue is where we undertook rapid SMS. It was introduced in on July 8, and that's how child registrations went. And similar trend for health reports as well, SMS health reports. So that's the big increase from our baseline. So July 6th is when we introduced it, and after that, people took a little bit of time understanding. So our teams took a little bit of time understanding as to what was happening, and then the big spike. But I do want to point out, with all of these examples, the thing to be cautious about are several and many. You have to, training and capacity is key. Really good field systems, can't overemphasize that. Data sources have to be well specified. So when we're talking about even something about school attendance, we had to create an entire, 6-page manual just so that our education coordinators, who are very bright people otherwise, for them to understand how to report attendance in the information system. So you have to be extremely precise, very diligent, and very detail-oriented. What is the source of the data? Is it going to come from school registers, or are you just going to go and talk to the teachers? Are you going to go and talk to the principals? Are you going to go and look at malaria data or infant mortality data from registers and clinics, which are in appalling condition because they never ever, registers in the field are treated as a luxury. So are you going to take data from there, or are you going to use mobile phones to collect that data? Are you going to go to child community health workers? Are you going to go to the doctors? Who's going to be the source of your data? Who's responsible for recording the data at source? This is not just so in another, for Nigeria as well, we have created what are called facility-based survey templates, which are on Android phones as well. And really, it's political, of course, who do you give the Android phone to and who collects the data. But really specifying to them as to who's responsible for collecting that data at source is really key. And then things that are related to the indicators themselves. How frequently should these indicators be collected? Are the indicators all time-bound? Is there a period of time after which the indicators themselves will become redundant? And who's responsible for collecting them? So, conclusion. What can you answer from a rigorous impact evaluation done by others? That's always the first question that you want to ask when you're trying to do an impact evaluation. Yeah? What are the questions that you can answer from an improved process evaluation? Can you bring together all of the elements of your process evaluation, your financial data, your economic data, your monitoring data? Can you put all of those together in a nice, robust whole and answer some of your questions? Are those answers then sufficient? If the answer to those questions to the last question is no, that's when you want to then go and do an impact evaluation. An impact evaluation is definitely many levels higher. You have to then select the top priority questions. What are the big questions that you want to take to your donors? What are the big questions that you want to report on in the press? What are the big impacts that you want to be able to talk about? Those should be your top priority questions. But they should link really, really well and in a very strong, defined way to the interventions that you're looking at. And that chain has to be articulated very smartly and very quickly at the beginning. So you have to establish a plan. Now, in many cases in the non-humanitarian development field, you have the luxury of time. Benefit of strategy: if you ask the right question, you're more likely to use it. And finally, I'm going to end with this cartoon, which says, you've got a problem with avoiding personal accountability. And yeah, whose fault is that? Thank you.
Thank you.
Absolutely, and I'm sorry that I didn't talk about it. One of the good intended consequences of undertaking surveys is that you actually end up identifying unintended impacts as well. And that's why I would argue for undertaking surveys and not just doing, not just collecting monitoring data. I mean, obviously there's a huge distinction between monitoring data one of the biggest ones for me is I cannot calculate standard errors on my monitoring data. I can for my impact data that's coming from my surveys. But and there's just the quality of data that you collect while you're monitoring is very different from the data that you're collecting when you're doing surveys and you have really assiduously planned out field operations. But when you have the luxury of undertaking surveys, that's how you're not just looking at a few activities, which is what you're doing when you're looking at monitoring. So you end up looking at, almost in the form of a living standard measurement survey, you're conducting a lot of data, and you will get, believe me, if you think that you're only going to get positive or wonderful stories to tell from your survey data, it's another story. We learned, very painfully that a lot of the things that we thought we were doing well, definitely not occurring, but that came out, those messages came out from our survey data, our impact data, and not from our monitoring data, because our monitoring data is so blinkered. Shocks, yes, those are par for the course. Couple of things. This is, again, the value of good monitoring and having field presence. So if, for example, if someone suggested to you, oh, you can just do an impact evaluation by going into the field at point 0 and then at point 3, I would just say that's not even possible, because you have to be knowing what's happening in the field in the interim as well. That's really going to give you a very, very good sense of what the operations are, how field management is going, what is actually getting delivered and what is not, and what are the causal chains. So at the beginning of time, you're going to put together a hypothesis of, what is going to happen on the ground. And there's a 100% chance that that's not going to happen. But what is going to happen is something that you're only going to get to know when you're looking at your monitoring data or your process data. And this sort of links up. So every time, for example, there's a shock. If the shock occurs across, say, the intervention site, say Port-au-Prince, but it also occurs in the north of Haiti, then that's equivalent. So just in an academic sort of discussion, if those shocks were to occur both at my comparison site as well as my intervention site, I'm set. Because the same shock has occurred, I expect the same changes to occur. So when I look at the data and I look at the differences in differences, I shouldn't expect the same difference will occur in both of the sites. So if the shock is different across the two sites, then yes, you have to be extremely aware of it, and you have to incorporate it into your analysis. So if it occurs, for example, in your comparison site, not in your intervention site, then you should have your field operations telling you that that's happening. And actually, in the Millennium Villages, we are then collecting process data as well in our comparison sites. So it's important to know, maybe not as assiduously, it's definitely not 82 indicators because we don't even operate there, but definitely a qualitative component, which is once every 2 years, we have a team that goes in, sees what's happening, knows the other donors that are coming in, so that you can really assess the quality of what your indicators are saying. I've always thought that indicators themselves are necessary evils. I mean, they are necessary because you need to be able to make some statement, but by themselves they are evil because they are very, very limited in what they convey unless you know the entire story around them. First, of course, there are perception surveys, so you can do those, and you can, but you should. In one of the components of the M&E system, which I didn't talk about for reasons of time, is a very, very assiduous process implementation science component, which is we've divided up not just what's happening to the people, but not just what's happening up to the beneficiaries, but also what's happening within the program, the organizational structures, etc. And there's a team of 2 postdocs who actually goes and looks at these very standardized questions that we have in a qualitative way. We're also using a software then that's used to analyze this data, the streams and streams of qualitative data and just interviews. And now actually Google has come up with a fantastic way of just mining qualitative data and prose as well. So you have tons of technology that you can use to collect data, but definitely process it. And I'm assuming in an organization such as yours, you have tons of reports coming in from the field. So using the advantage of technology, there's tons that you can do even in a qualitative way to figure out behavioral responses. Oh, definitely. I don't think I excluded one for the other. The only statement I was making was that it would be useful to use financial data. But indicators, there are tons and tons of indicators that we would use, and people reach would definitely be one of them. Yeah.
Thank you, Joe.